develop at very specific sites in the brain. For example, they appear in centers of higher intellectual functioning, such as the cerebral cortex and hippocampus. These structures are involved in memory formation, calculation, and orientation. On the other hand, the motor centers are initially spared: the motor cortex, basal ganglia, and cerebellum. As the disease progresses, the brainstem and hypothalamus become involved. As the neurons become dysfunctional, they progressively degenerate. This results in abnormalities in various neurotransmitter systems. Neurotransmitters affected are somatostatin, serotonin, noradrenaline, gamma-aminobutyric acid, excitatory amino acids, and most importantly, acetylcholine. This neurotransmitter, which plays an important role in memory, is characteristically decreased in the brains of Alzheimer's patients. The pathological changes in the neurons and neurotransmitters are responsible for the symptoms of Alzheimer's disease. The disease follows 3 stages, and its early stage is often unrecognized.
The more we've studied the disease, the more we realize that there are several ways in which the illness can begin. Okay, what year is this, would you say?
I forgot to study all this before I came. And so 1996.
1996, does that sound right to you?
Yes.
Let me give you some alternatives.
Okay.
It might be 1975, 1992, or 1996. Which of those sounds right to you?
96.
Okay, very good. Memory loss is almost always apparent in the initial stages of the illness, but in some patients there will be a very marked language change, and in others, language will be relatively spared. I see. Can you tell me the names of these things here?
Buckles.
What are they called?
They're, it's a bone, and I call them buckles.
Buckles.
Yeah.
Would you call them buckles? In some patients there may be very marked visual spatial changes, whereas in others, visual spatial skills will be relatively intact. Some patients may present even with psychosis, so that they develop delusional beliefs about theft or burglary or infidelity of the spouse, and that may be the presenting feature of the illness, only to evolve later into the full-blown picture of Alzheimer's disease.
As the disease progresses into so-called middle stages, patients experience a worsening of symptoms. The patient loses spatial orientation and cannot organize thoughts. He or she has difficulty reading, writing, and working with numbers.
I'd heard that you were a model.
Yeah.
Is that true?
Mm-hmm.
Can you give us one specific memory that stands out in your mind about when you were a model?
That's the bad part. Tell you when was the time of the model or something like that. But that is something that is usually in a room like this, a little smaller, a little wetter.
Now, can you draw the hands on this clock so that I would read it as 10 minutes after 11?
10
minutes after 11.
Okay, I'll do it. I'll try it.
Okay.
10 minutes after 11. That really true?
Mm-hmm. You tell me.
Okay. Is that the only thing that we have
you
to
got it?
put in
Does that
it?
say 10 minutes after 11 now?
10 minutes after 11? Where can I put that? Here?
In the advanced stages, the patient can't communicate with words and doesn't recognize family.
Would you say that this is your hand, or your shoulder, or your knee?
Well, that's true. No, and
Okay. Let's try this one down here.
The proper management of the patient with Alzheimer's disease begins with an accurate diagnosis. Unfortunately, the symptoms of Alzheimer's are often similar to a number of other dementias, some of which are treatable. Brain biopsy is the only way to make a definitive diagnosis, but it's rarely performed in living patients.
There is no specific diagnostic test for Alzheimer's disease. There's no blood test, there's no cerebral spinal fluid test, or no imaging test that says, yes, this is Alzheimer's disease. So what we are looking for is a specific profile of clinical deficits, the absence of neurological deficits, and